Hi there, I'm Dr. Jordan Adrian, physical therapist specializing in treating shoulder pain in the active adult and owner and founder of Limitless Concierge Physical Therapy based out of Lakewood, Colorado. In this video, we're going to be discussing shoulder impingement, what it is, what causes it, what are some of the common symptoms that our patients report, and what are the treatment options that are out there in order to help address the underlying root causes of this condition that will ultimately lead to long-term lasting results. In speaking about the anatomy of the shoulder joint, I'll often use the analogy of the shoulder joint as being similar to a golf ball sitting on a tee. As the head of the upper arm bone, or the humerus, is shaped like a ball and is considerably larger than the socket of the shoulder blade that it sits in. Because there is such a large discrepancy between the size of the ball and the socket, it relies heavily on the right balance between muscles, tendons, and ligaments. The rotator cuff is a group of 4 muscles and tendons that attach the shoulder blade to the ball and socket joint. And its main function is to help to hold the arm bone in the middle of the socket, which allows for smooth, pain-free movement and normal shoulder function. In my experience in working with hundreds of patients with shoulder impingement, there are a lot of commonalities in the symptoms that this population will report, with some of the most common being difficulty laying on that side that either keeps them from falling asleep or wakes them up multiple times throughout the course of the night. They may also start to experience limited mobility in certain directions, difficulty reaching behind the back, reaching across the body or all the way overhead. They may also report experiencing some clicking or popping sound when moving the shoulder, especially through certain ranges. A lot of times there'll be kind of some pain through the mid-range of the motion around shoulder height, and then once the arm is elevated up high enough, that'll free up space in between the ball and the roof of the shoulder blade, or the ball and the socket, and will reduce symptoms that are noted in that particular direction. Shoulder impingement can occur when these tendons and muscles become compressed or pinched underneath the roof of the shoulder blade or between the ball and the socket when the arm is lifted or manipulated in different motions. In many cases, the mechanical shoulder pain, the person has developed an imbalance of the muscles around the shoulder joint, leading to the ball being slid out of socket, most often forward or elevated up into the socket, reducing space between the bones. Compression of this space in tendons or the bursa can result in inflammation, pain, and decreased mobility in the shoulder joint. If you suspect you have shoulder impingement, it's important to see an orthopedic physical therapist who specializes in treating shoulder pain and dysfunction for a proper movement-based diagnosis. In most cases, conservative treatments such as physical therapy, which can include limiting aggravating activities, adapting positions or postures throughout the course of the day, and prescribing the right combination of nutrition and supplementation, can help to reduce the pain and inflammation that you're experiencing at this point in time and help to improve your mobility and tolerance for exercise enough to where you can start to perform corrective movements that help to address the underlying root cause of your condition and why it formed in the first place. In very rare cases, surgery may be necessary to correct the underlying issues in the event that you have already formed a significant rotator cuff tear. However, fortunately, this is relatively rare, and the vast majority of cases can be treated conservatively without surgery, which can save you considerable time, pain, and expense. A good physical therapist can recommend the best course of action for her treatment for your individual needs in your individual case. I hope you found this video informative, and if you're experiencing shoulder pain, don't ignore it, as addressing your issue earlier on can often help you avoid more costly interventions such as MRIs, injections, or surgery. If you think you may be experiencing pain associated with shoulder impingement, or are unsure as to the source of your shoulder pain and what the best course of action is moving forward, Feel free to reach out to us by clicking the link below to set up a completely complimentary 15-minute case review phone call with one of our doctors of physical therapy today. Or for our complete shoulder impingement movement screen, which we formulated based on years of experience and hundreds of successfully rehab patients suffering from shoulder impingement, click the link below and comment impingement on the Contact Us portion of our website, and we'll be happy to send you a copy of our complete shoulder impingement movement screen so you can start getting clarity on your condition today. Thank you for watching, and be sure to like and subscribe to our channel for more videos on all things shoulder health and wellness.